Welcome back to Beyond Well. I'm Sheila Hamilton, and today we're going to be talking with Dr. Justin Palanci. He's an assistant professor at Emory University School of Medicine in the Department of Psychiatry and Behavioral Sciences, and he serves as medical director for the Assertive Community Treatment Program at Grady Memorial Hospital. He's also co-director of Open Dialogue Atlanta, an outpatient program that's located at the Grady Behavioral Health Clinic. Justin, it's so good to see you.
Thanks for having me.
You know, one of the most fascinating things for me during this entire pandemic is to learn about the way that some of the tenets of open dialogue can help. Why do you think that is?
I think that the idea of the importance of having a social network, the importance of feeling socially connected is really important during this time, as it is when someone's in crisis. The ability to tolerate uncertainty, right, which is something that we're all having to do right now. And that includes the uncertainty of not knowing what exactly the right way to move forward is. Again, these are several questions or dilemmas or challenges that we face when we're working with someone who's in crisis. And I think it's certainly parallel during this time for all of us.
Yeah, I've just been so struck by if anyone could learn these communication skills, this way to listen actively without judgment. I've just been this is so helpful for the universe to know right now. I don't know a single person that couldn't benefit from it. So tell me how you first learned about open dialogue and what attracted you to this type of network approach.
Yeah, so I was invited to participate in the program of bringing open dialogue to Grady and Emory, which Rob Cotes, one of my mentors and now colleagues, led. At the time, I was actually ending my first year of residency, and I had spent a lot of time meeting with families for individuals who I was helping to take care of on our inpatient unit. And I was struck by the importance of doing that, of including families in the process. And, the other thing that was really fortuitous about the opportunity was I was working with a social worker on the inpatient unit quite closely. And she and I formed a team of working, to meet with families and, having these challenging conversations. And then to learn about open dialogue and learn that, they support the idea of working with more than one clinician, including some of the other things. It was very, it resonated with me right away that this was a good way to work with people.
I've gone through different parts of my life where I've sought out great counseling or therapists, and any therapist that would ever sort of start writing down his notations about something that I said really irks the patient, because you feel as if there is a judgment going on that you're either not coping or not handling, or, we never say they're writing down, wow, she's an amazing person, right? Do you know what I mean? So
Yes.
it causes the worst type of conclusion jumping for the patient's point of view. So I totally understand how that could completely work in a patient's mind, is to be able to have it said openly. Well, here's what I'm thinking, instead of writing it down, and covering my hand so that you don't see what I'm saying.
Yeah, it's when we first introduced the idea of a reflection, sometimes families, they kind of look at each other and they think, well, should we leave the room? Or, okay, I guess we'll wait here while you go and talk. And they were like, no, we want to do this in the room with you. We would love for you to listen and share your thoughts about, what we've shared, what we got wrong, what we got right, anything that, stood out in particular. So it's a little bit of a different idea, but it's a really powerful aspect of the approach, I think.
So tell me about what you had to unlearn in order to be a good open dialogue facilitator and trainer.
I think the biggest thing is really how to listen in a way that is not listening for problems, not listening for symptoms, that really is listening as a way of understanding. I think we spend a lot of our time in psychiatry learning how to do a good assessment. It's really easy to be in assessment mode. Not that assessment is not important on some level, but I think I've had to unlearn how to listen more from a way that I want to understand this person's experience. And that's the most important thing. Recognize that comes with time, and that comes when we find a shared language to explore their experience with. And
does that mean, Justin, sorry for interrupting, but does that mean that you you neglect a lot of those diagnosis terms that you have to reject in some ways the terminology that you were trained to use as well?
Well, I wouldn't say it's a complete neglect. I guess what I would say is my approach or my way of handling that is to try to explore what words the person wants to use to explain their experiences. Mm-hmm. And sometimes those words might be more clinically focused and sometimes less so.
Oh, wow. And so, that's wonderful.
So, I mean, the idea for me is to kind of work together to find the language, as opposed to me saying, you need to use this language, right? So I'm going to talk about auditory hallucinations and you need to tell me yes or no. Yeah. But instead, so.
And in terms of potential treatments, one of the things that I have been thinking a lot about is that the psychiatry model has a lot of drugs you can throw at, these people's problems. When you're attempting to try to form a different pathway of speaking about and learning about a person's lived experience, what other kind of things can you offer that are not psychiatric, that are not psychopharmaceuticals? What do you have in your toolbox?
Well, I think first and foremost, I have an intention of wanting to understand what a person has been through and what they're going through and where they like to be headed. Mm. And that I do that with not alone. I do that with their support network and with my co-facilitator or facilitators, of course, in a way that I think can be really therapeutic. And I think as a network, we're often able to generate ways to move forward that may or may not involve medicine as part of the plan. Yeah, I mean, that can include things like just spending more time together, talking about things in a certain way that haven't been spoken before or haven't been spoken to in a way that has allowed people to, within the family, a family to feel heard or feel understood. Those conflicts, they can be a great source of tension, of stress, and those can all lead to, unpleasant experiences.
I think anybody that's been in quarantine for 2 months understands that now, don't they? They don't have a difficult time understanding that. How do you think young people are experiencing psychosis for the first time when they're able to actually tap into this type of training and network?
So, I think that a common theme is this experience of the feeling of my voice isn't important. And trying to create a space where a shift occurs. If someone says something that we don't understand, we often might say, "No, that doesn't make sense. What are you talking about?" We can be very dismissive of that voice. Mm-hmm. And I think I would say our program aspires to create a space in which that voice can be understood. While on the surface, it may be hard to understand, that maybe if we spend some time looking at the words carefully or exploring them together, we might be able to find some meaning in them.
Yeah.
And so...
Has the pandemic affected your work any differently?
It has. I mean, I think it reinforces the importance of family-based work. Whether families are spending more time together or more time apart, I think finding ways to foster a sense of social connection and to, talk about topics and things in a safe space, in a welcoming space has really been important. Mm-hmm. We've actually, there's been some instances where, because some of the barriers of transportation, we're using telehealth now. And so the barriers of transportation have been removed. The extra time it takes to travel to and from clinic have been removed. So we're actually able to meet more frequently in some cases with families.
Yeah.
There's still some challenges. I mean, I think one of the things that open dialogue teaches us is to respond not only to verbal utterances, but nonverbal utterances. Mm. And it's a bit harder to do that. Certainly over the phone, you're not seeing folks, but even, via a telehealth model, it can be challenging to do that. But for the most part, I think it's been success. We've been able to successfully transition during the pandemic and still continue to support our patients and their families.
And has it provided any new opportunities for dialogic practitioners right this moment? Has it provided more people are interested in it because it does seem so smart?
Well, I would say this, it's interesting. We've had a couple families who we've worked with in the past kind of come back and say, we'd like to continue meeting. Some patients who are that were sort of more ambivalent a few months ago have kind of reached back out. So I think from the patient family side, I think there is a sense of, again, the importance of social connection and needing to have a space to kind of to talk in a safe and therapeutic way.
Right.
So yeah, I mean, I think there's been a shift in the interest in the wake of the pandemic.
And what kind of challenges do you see because of the pandemic? Are there any specific in terms of the growth of being able to allow other people to train this way?
Well, yeah, I mean, I think in part, I don't know, others may have had different experiences, but I think when this all started and we were we're sheltering in place, there's kind of a sense of, okay, what is the bare minimum I need to do? There's been so much asked of us to sort of balance out our work lives and our home lives. And it's kind of, okay, what are the sort of core things that I need to be doing? Mm-hmm. And I think sometimes it's hard to introduce new skills or new ways of working during that time. I think as we go on, people may be more open to new experiences, new training opportunities, et cetera. And hopefully, dialogic practice can be a part of that going forward.
Wow, I have loved the conversations today. Thank you so much for taking time out of your morning, and I hope we made it right in between your sons or daughters' naps.
Thank you, Sheila. It's been a pleasure. I really appreciate the time.
You bet.